Chiropractic is art and a science, if you like, but there's the scientific elements which we really hold dear here. I think there are plenty of opportunities to get more involved in mainstream if the profession wants to.
What do you consider makes a good chiropractor? Now you've been educating them for a bit.
Yeah, absolutely. Well, I think the main thing is that, like any healthcare professional, that they are ultimately person-centred and think about the individual that they're treating. I think that I can't stress that enough, that the value system is actually really important for anybody working across the sector, so that we work in a patient-centred rather than a practitioner-centred way. What that means is then we can develop really good therapeutic relationships, and I think chiropractors are very good at doing that. So having excellent communication skills, so that it's the only way that we can obviously get what we need from a patient to help them and support them in the way that we need to. I also have a passion that chiropractic is a art and a science, if you like, but there's the scientific elements which we really hold dear here, so that we're evidence-based, and it's really coming from a strength of a high-level scientific knowledge base that feeds then into the practice excellence. So clearly, chiro is not solely a manual therapy profession. Of course, there's an exercise prescription, all sorts of adjunctive aspects to the care that chiropractors provide. But I do think that the level of skill that chiropractors can bring as a manual therapy profession is really, really critical.
That's great. So what do you think the future holds for chiropractic education? How do you think it's going to develop over the next 10, 15, 20 years maybe?
Well, I suppose, it would be sensible to think that chiropractic, like every other healthcare profession, can learn from what's happening in other professional groups, so that we know that we need to increase diversity across professions, because our patient base is diverse. And that's quite hard to do in a 4-year degree program, because we tend to get students from a particular background and so on and so forth. There's so a 4-year degree for students that have come in with healthcare qualifications is quite tricky. So we're trying here in the UK to make sure that we can improve diversity by going out and trying to get students to come in from different backgrounds. I think it's increasingly important and recognised, especially in the wake of the COVID pandemic, that having a high level of practice element all at the end of a course and not having embedded it throughout the course will become, as it has been with this, quite problematic. So how do we ensure that students are getting access to patients on their way through their training at whatever level, in whatever, so that they're safe to practice in whatever element that might be. And that might be exercise prescription, that might be helping with some diagnostics, it might be whatever. So I think that exposure, so that they develop those skills and develop the patient-centred relationships, is actually really important. And obviously it means that they're getting exposure and understand what's expected of them within a practice environment. So I think that will be quite different, but I think that will change things quite a lot. I'd like to see, I suppose personally, that more opportunities opening up for chiropractors within the new musculoskeletal frameworks nationally, which are being really well funded and backed. But I suppose that remains to be seen as to where politically things sit. But I think there's huge opportunities potentially for those that want to work across advanced practice.
So when you take the clinical experience that your students are getting at AECC, that's a very large clinic facility that you have on site. Yeah. Do you see an opportunity for outreach work as well while they're students, or do you think that's something which should be tacked on as a sort of postgraduate element?
No, I do think that should be part of an undergraduate provision, partly because the students then, they don't become, I suppose, not institutionalised is too strong a word, but they appreciate there are several ways to approach practice, which may not just be what they're getting in the clinical setting. It is harder to ensure high quality provision, especially as you're building that up outside. But I think we're very lucky in Bournemouth because we have got so many fantastic chiropractors and large practices around this area. So I think that we've got lots of opportunity to do that here. And I think that colleagues in practice often really enjoy having students. Actually, it's refreshing. It's rejuvenating. It makes you question your own practice and reflect on your own practice. I think there are lots of benefits to that, but that takes a bit of setting up, and to ensure equity of opportunity for students and the quality that is required in chiropractic is quite a challenge as that gets rolled out. Yeah. So I can see that we would offer some of that, but with obviously the core of the practice being in such a busy clinical setting for us, which does so much work in the community, is a really unique part of our offer.
Yeah. Here. Well, that leads me on to my next question, which was, what do you think is unique, and what does AECC excel at? There's an opportunity for you to sell.
Well, I think it's incredible. I think we do have incredible facilities, amazing resources, which we've just expanded as well. So we've got a new diagnostic imaging suite, which split new, supported by colleagues at AGFA. So that's really important. It's an area of practice that we think is actually really important to ensure that our colleagues have exposure to on their way through the training. We've just got funding for a new rehabilitation centre. So again, that will really enhance the broader chiropractic knowledge. And I don't mean that they may practice in all of these elements, but that they have an appreciation of where chiropractic sits within healthcare. The clinic, I think, speaks for itself. It's incredible. It's huge. It's vibrant. It really offers students an incredible high quality experience. So that I think they're as good as they can be when they then go out and practice on themselves. But I'm also very lucky because I think we've got fantastic staff who are very knowledgeable. We've got many doctorally qualified staff who are researching and operating at the highest level. We've got spinal research going on. We're working with King's College, European Space Agency, looking at spinal motion. I think people can dip in and out if they are interested to work across the board. But I think Centre of Excellence is used maybe too often, but I do actually believe we're a centre of excellence in musculoskeletal. And
also, it's very good now to see the integration, so that students are getting experience of learning with other disciplines. That's, I think, one of the comments that people have made about the independent private institutions is that while the people become very focused on being chiropractors, they don't necessarily see how they could fit in with other disciplines. So by learning with them, you break down some of those inherent barriers that are built up otherwise. So,
and I think our vision for the future is very much to marry, as a specialist health sciences provider, is to marry education opportunity with clinical opportunity on site, as well as applied research opportunity on site. And mostly you have education and some maybe applied research, but to have all three, to the extent that we have it, is very unique as a university.
Yeah, and I suppose that takes me, you've touched on this before, but looking at the future, and where do you think the profession might be in 10, 15 years' time, and where do you think the opportunities are that we should look at? I know that you're not a politician, but you've worked within that sphere, and coming from the physiotherapy profession, you've probably got a slightly different perspective than the chiropractors might have. So I'm interested to see where you think we might fit and how we might develop our profession.
I mean, it's one of those things. I think it's about I do think it's up to the political will of the profession to a certain extent, and to see where people, I think there are plenty of opportunities to get more involved in mainstream if the profession wants to and can access that, which will take some political driving to move into that space, partly because it's so private practice orientated, similar to something like osteopathy. So it's very hard to demonstrate that chiropractic, I think there's no doubt that chiropractic has great efficacy, and all approaches across chiropractic, there's nothing difficult there. I think that the research is there. What mainstream healthcare is looking for is actually for efficient care. So looking to not see people, looking to do it virtually, looking to not necessarily put hands on, looking to whatever. And I think that's where it jars, isn't it, for a profession that really prides itself on its therapeutic relationships with patients, on a holistic approach to care, getting hands-on. It's not necessarily where the mainstream healthcare professions have been going.
Yeah.
So it's quite hard, I think, to bring that into the profession, see that on a wider area where you're actually almost seen as a consultant, navigating someone through care as much as literally interacting with someone. So I think those opportunities are there, and they're there for people who are wishing to work in the mainstream care. But I think there's still a little bit of political work to be done to open up those avenues.
I suppose we've got to watch and see what the NHS is going to do anyway, how that might change over the next 10 years as well, because the health service is inevitably going to face challenges, and it'll be interesting to see what...
Absolutely. And there's huge amounts of work going on at the moment looking at musculoskeletal services.
Going back to AECC, and you've talked about the elements of the institution which you think are attractive and are excellent and are interesting. You also talked a little bit about diversity, and there certainly is certain elements where we have increased the diversity of students. There are also many areas where we haven't. What do you think are the best sort of recruitment tools that you would employ to try and increase the numbers, but also the diversity?
I think if you look at how that works elsewhere, really, it's more around just getting involved at school, as you guys have done the SPCE as well. It's sort of having materials that can be sent out, demonstrating it's an attractive career, opening up opportunities so that students can come and, and I mean school level, college level students can come and observe. So are all chiros happy to do that? Because there's not an NHS they can go to for that. So it's really about who's willing to do that, have someone come and watch them, excite the next generation about the profession, selling the benefits of being able to work independently, flexibly, around other interests. So I think there's lots that's very attractive about working as a chiropractor. And that really starts at probably not even year 12, but year 8 in schools, and having lots of good marketing information out there.
And also making sure that people realise that the opportunities are there once you get into the profession. And they will change. I think there will be differences, but it is something which has got a little way to go yet before it's clearly obvious, I think. Yeah,
no, absolutely. As I say, I think effectively it's a national marketing campaign, really. Yeah. But what it would be nice to do is actually to attract more students from areas which traditionally, haven't maybe got chiropractors in the backyard. So how do we draw those students into chiropractic?
Well, so that was another motivation behind the Teesside and the Preston initiatives, to try and get education opportunities available in places where traditionally there haven't been. I mean, Bournemouth, as you've highlighted, is a very fertile ground for chiropractors because it's been a training ground for so long. And I think it would be very helpful to try and get everybody into this conversation, to try and use the resources and use the energy that people have to try and help with that recruitment. So that's one of the things we should be looking at.
Yeah, and I think the ultimate difficulty, though, is that chiropractic is a 4-year degree, which the perception of that is quite challenging for students from non-traditional backgrounds.
Yeah. Well, the other thing I think, and one of the questions I which I didn't actually put on the list, but is what your opinion is with regard to entry requirements, because just having a very high bar to jump over to get in isn't also, I mean, it tends to focus on academic elites rather, and that tends to disenfranchise some groups as well.
Yeah, I mean, obviously, I'm sure Peter, here we have an access course that we run, and which is chiropractic focused, and obviously, and it's very standard, of course, to have foundation years. But again, that's 6 years of education, which is quite something for someone from, that may be the first into university from their own backgrounds and thoughts of taking on that much debt. And I don't just mean from tuition fees, but from living costs. So I think there are a few barriers there about how we support that, and really that has to be something that people really want, because why, they could actually go and do physio in 3 years, or they could do whatever. We haven't got apprenticeships. So lots of those that are coming through in the other professions that might look that may be comparable professions to the student looking to study a healthcare profession, and they could go and work as an apprentice up the road.
So that means looking at styles of practice as well, because if we remain in the same style of practice of just working within private practice, numbers of patients, etc., the opportunity for apprenticeships is much lessened from that point of view.
Yeah, and actually, in order to have apprenticeships, you have to have trailblazer groups and develop apprenticeship standards and that sort of thing. That's not been done in chiropractic, whereas it has been done increasingly in some of the other groups.
So that's another thing. Is there anything else you'd like to talk about while you've got this opportunity?
Oh, gosh. Well, overall, I just think, the other end of it really is about research and standing, and that's something that we're looking to start to put the foot to the floor on a bit here.
Yeah.
To try and really raise the bar for chiropractic research as well. I think that's there's something around the credibility and moving that forward in a profession that perhaps has got some absolutely incredibly well-known researchers, but it's the exception rather than the rule. How do we attract more chiropractors to do research at the other end of the spectrum, not just bringing them in at one end, but how do we keep them to be active researchers? We're very lucky here. We have several studying their doctorates and delivering that on site here. So we know that there is demand. We want to raise the bar at that end too and make sure that we can keep pushing.
Well, certainly my experience going through the various roles I've had is that the barrier very often has been credibility, and credibility is enhanced hugely by good research, which can back it up. So anyway, well, that's very kind of you, Lesley. Thank you very much for your time today.